Well, frontline workers such as doctors and nurses will be among the first people to receive the COVID-19 vaccine when it reaches our shores. This is according to government's policy position on the vaccine. But there are mixed views at this point among South Africans. Some are quite skeptical about the vaccine, while others are positive. We speak now to Denosa's Sibongiseni, Delihlazo, to find out if they will encourage their members to take the vaccine. Mr. Delihlazo, thank you so much for your time. And welcome to the South African Morning. And that is a big question. Even though the President has made that provision for healthcare workers, including nurses, the question is, are you encouraging it to your members?
Well, good morning to you, Tumelo, and good morning to the viewers at home. Well, really, lack of information is what has characterized the new vaccine, and we believe that there's a need for more information. In fact, it's not only nurses who are having who are having skepticism about the vaccine. Everybody is discussing it on our social media networks and even professors themselves. So this obviously is indicative of the need to cascade information down to healthcare workers, because for you to make a decision on whether to take a vaccine, it will be based on the information that you get. So the information is a bit sketchy at the moment, and we hope the department will up its game to ensure that information cascades down to healthcare workers, because they are the ones who are going to drive this program. And in fact, before they obviously vaccinate people on the ground, people need to be informed. They have to sign a consent form. They can't sign that if you don't explain it to them. How will they explain it if they don't have information themselves?
Right. You know, I was reading an article where it seems that not only is there skepticism amongst South Africans with regards to the vaccine, but also there's a conversation as to whether, people will be enforced to take it by their employers, because perhaps employers may take a stance to say, if you do not take the vaccine, that you are a risk to, your fellow colleagues or even to your patients in the context of nurses. What conversation do you think employers need to be having, amongst themselves as well as with their employees, even in the context of nurses?
I feel this is quite simple. Openness is what is needed here. In fact, people may not be taking the vaccine based on poor information or lack of information. I think it would be quite grossly unfair of employers to force employees to take the vaccination, whereas they themselves have not explained it to them. Just explain it. It's simple. Everybody wants to be safe from this pandemic. In fact, from the perspective of healthcare workers, it has killed so many healthcare workers. We have not lost less than 435 healthcare workers, and that is huge in our country with a shortage of healthcare workers. Therefore, simple information cascaded down in a simple way, easy to understand for end users. In fact, during the first phase, healthcare workers themselves will become end users. Yeah. They must sign consent. They must consent before they get vaccinated. How will they agree to be vaccinated if they don't have enough information? So information needs to cascade down. We believe that the Department of Health is in the process of rolling out mass communication strategy and onto the ground. We hope that that does become effective, because we don't have time, because from next week, and first week of February, it's expected that we'll be implementing the vaccination on the first category, which is the healthcare workers. They need to be informed. And when they're informed, they will be able to explain to patients when they ask questions, so that patient can make informed decision and agree to be vaccinated or not.
I'll need to let you go in a few minutes, but before I do, just quickly, what questions should the nurses also be asking, when it comes to the vaccine? Also, when it comes to even the infringements of their human rights, what questions do you think they should also be asking?
Well, everybody is concerned about their well-being. For instance, not too many people are aware, of what process. And of course, it's been a bit of a shock, because the manner in which it has been a fast track, the issue of the vaccination. Of course, we understand that, because funding availability was not a difficult thing to get. And when you've got funding, then it's easy to get vaccination. People are concerned about their well-being. If you take any medication, you need to be aware of the side effects. What if you're going to die tomorrow if you've got some condition which perhaps the vaccination itself may exacerbate? Those are simple questions that need to be explained. Of course, we're not saying it's got such drastic side effects, but we need to be told what are they, so that healthcare workers are aware and are able to convey this message to healthcare to patients on the ground.
Denosa, Sibongiseni, Delihlazo, thank you so much for your time.